Good morning. Today, just now we completed a very good foreign body removal with the bronchoscopy. So now I am going to show them how the instrumentations are and how we do our procedures here. Okay. So the first and foremost thing you saw is the child was there, and then once the child was under, I used this laryngoscope. The laryngoscope in the left side, I open the mouth, just visualize the larynx. Look if there is any foreign body here, then apply gentle suction around the larynx, not inside the airway, because if you suck inside the airway, the oxygen will all get off and then the patient will go for hypoxia. So you just suck around it, and then just if there is minimal secretion in the airway, just suck it, come out. The next thing I do is, by the time my suction is coming out, the scope should be delivered in my right hand by the next assistant. Then I insert it with the lens alone into the airway, and then I take this scope off. Now the scope with the lens goes into the airway. I just go beyond the vocal cords, go into the trachea. This is the trachea, and then go and see both the right and the left bronchus. And then if there is a foreign body that I can see, I just notice it and then I come out. Again I leave the patient for the masking. By the time you have passed the scope, there will be some amount of hypoxia. So again the anesthetist will be ventilating the patient. Now the next thing I do is, now I know which size, where the location of the foreign body is, and what is the age of the patient, and what is the size of the trachea. I know gently. So then I have to choose the appropriate sized bronchoscope. In this particular foreign body case, even though he was a little older boy, this could have been an easy scope to go into the trachea. Okay, and visualize even the right mainstem bronchus. But the foreign body was located in the left terminal bronchus, so I will not be able to access with this bronchoscope all the way there. So I need to choose a bronchoscope which is small enough to negotiate into the left secondary bronchus, if not even to the terminal bronchus. So once again I had to choose the smaller size bronchoscope. Here I chose the 4 or 3.5. So either we can use the 4 or you can use the 3.5. So 3.5, next thing you have to do is, you have to attach the prism. This is called as prism. So this is like a light carrier. So you have to insert this into the bronchoscope here like this. So there will be 2 tucks, 1, 2. So if you put 2 and then attach your light source here, then the brightness to see for the assistant will be very good from here. But when you put the 2 ticks in, the instrumentation, for example, if you want to pass the suction or forceps through this, there will be some impedance. So if you want to do that, once you visualize what the place is, then you just with your thumb just do like this. It will go to the first tick there, and then hold it. Then you insert your suction out the secretions, and then once you come out, you just put it back, visualize where you are, and then once again you should be now ready with your foreign body forceps along with the scope. So when you are using the foreign body forceps, you have to choose the forceps what you are going to use. If it is a peanut, this is the peanut forceps we use it. This is like this. Okay, and if it is like a whistle or where I have to use my sharp edge to hold it, I use this one. This one. You see that there is a small prong there that will hold it like this, and I can take it. If I need more grip entirely, I use this kind of serrated one. Okay, and then I take it out like a coin or something where I need a good grasp. So once I know what the forceps I am going to choose, if the forceps is like this, the endoscope should be held in upside down so that light carrier. I pass this through the forceps and then lock it like this. Then if I have another light source, that will be the best thing. You can attach this light source to here. So while all this is happening, the patient is being ventilated, and now the assistant holds this alignment, it's ready, and then once again I insert my laryngoscope and the bronchoscope, whichever I have chosen. And once again, while inserting this bronchoscope, I may need a light source. If a second light source is available, then it is well and good, so that I can use this. I don't have to switch the light. Once I am going inside, I remove this. I position myself just proximal to the bronchiole where the foreign body is, just proximal. If the foreign body is here, I don't go all the way near the foreign body, just a little proximal. I place it, and then I hold it like this, support it, and then I remove the light source, attach it to this, and then I pass on this assembly through the scope. See here, the stick all the way inside. So once I pass it all the way down, I will be visualizing in my screen whether the foreign body is being held by this forceps or not. So here, that happened to be a vessel here. This is the vessel that I was just removed. I hold the foreign body securely, and I will try to mobilize it only until the proximal end of this bronchoscope. That's all I can move. I should not move further. If I try to move further, the foreign body will slip off from the scope and from the forceps. So I just should hold it in just proximal to the distal end of the bronchoscope. And then once I'm holding it securely, I have to move the entire assembly. Let's say this is the bronchus and trachea. I have to move the entire assembly out. So once it is out, I just leave it into the container. Then again, I should be very quick. I have to remove this, and I have to only take the forceps out and pass the lens inside and see if there is any other second foreign body there, or if there is any bleeding, or if there is any injury. And then if I need to do suctioning, I take it out, I put my suction there, I suction out, make sure there is no hypoxia. If there is, you can attach, this is a ventilating bronchoscope, you can attach the anesthetic oxygen into this end. So once the oxygenation is secured, you know that the patient is breathing well. This is how we can attach if needed. And then you once again take the scope out and then give the patient to the anesthetist. If needed, you can even intubate the patient and give it to the anesthetist, or if not, if you are sure that the patient has come out very nicely, then you can stop the procedure and give the patient to the anesthetist. Again, you auscultate the patient, make sure you ask for a chest x-ray, and then make sure your recording is fine so that you can discuss the findings with your patient's family. Thank you. Now we are going to see the actual removal of the foreign body from the bronchus in the live. So this is a child who had come with a history of choking, and the x-ray was shown just before, and now we are just using the same techniques. We suctioned and then we are passing the endoscope through the trachea, and now we are entering the right mainstem bronchi, and we are also seeing the left bronchus mainstem. And as we go through the mainstem, we are now going through the secondary bronchiole, and we can see that there is a small greyish foreign body in the distal part of secondary bronchiole. And once this is confirmed, we are just withdrawing the scope out, and now we are going to insert the bronchoscope along with the foreign body forceps. And this particular forceps is the foreign body grasping forceps. And now we are going into the left mainstem bronchus, and then we are going into the secondary bronchiole, almost in distal secondary bronchiole, and we are trying to grasp the foreign body, which is looking like a plastic material as of now. That's why it was not showing up in the X-ray. Now with the technique that I had shown, we are removing the foreign body along with the forceps, along with the bronchoscope in one single unit outside. This foreign body happens to be a vessel, and we have to make sure that whether the foreign body has come out in toto or if there is any piece of the foreign body missing. And here we have completely removed it. Once the foreign body is removed, we insert the bronchoscope again. As I had mentioned in my lecture before, we are tilting the head and going into the left side of the bronchus. And as we are going, the anesthetist is trying to use his ventilating channel into the ventilating attachment in the bronchoscope. And now we are examining to, number one, to see if there is any bleeding, or number two, if there is any other second foreign body. And then we are inserting the suction to remove out the clots or any secretions there. And then once again reinsert the lens into the bronchoscope and do a check bronchoscopy to confirm that there is no other foreign body and there is no bleeding. And this is the check bronchoscopy that shows that the foreign body has completely been removed, and this is a view of the terminal bronchioles and the secondary bronchioles on the left side, which is little unusual to get a foreign body on the left side, even though right is more commoner. And this is the right side bronchus intermedius and the terminal bronchioles. And as I come out, you can see the right upper bronchus. And then we are completing the procedure. We are removing the bronchoscope, and this completes the procedure. Thank you.